talk us through the latest figures.
Good morning, Kirsten. Well, New South Wales has recorded this significant jump once again in the number of cases recorded for COVID-19. There were 35,054 new cases recorded to 8 p.m. last night in that 24-hour reporting period, and we've also sadly recorded another 8 deaths. Hospital admissions are up as well. There's 1,491 people being treated in hospital, and 119 of those are in the intensive care unit. Now, these results come from over 108,000 tests which were performed in that reporting period, and testing clinics across the state have continued to face these enormous demands, and people are having a lot of difficulty finding rapid antigen tests as an alternative to lining up, sometimes for hours, to get one of those PCR tests. Nurses have told the ABC on a confidential basis that they're facing extreme burnout in the hospital system, and some of them are feeling pressure to not take sick leave or even mental health leave for fear of creating more staffing issues. The Premier, Dominic Perrottet, has spoken just an hour ago, and he has acknowledged that there is a lot of concern and anxiety in the community about these rising case numbers. But again today, he has insisted that the state's hospital system is in a very strong position to cope with the increasing case burden. Let's have a listen to some of what he had to say.
We do expect to see a sharp escalation, continued escalation in case numbers, but the experience around the world with Omicron is then followed by a sharp decline, and we also know that Omicron is much less severe than the Delta variant and previous variants before it. The other point I would just make once again is just in relation to those queues and in relation to close contacts. I have received substantial feedback that people believe they cannot go to work because they are deemed to be a close contact when they are actually not one.
And Jamie, there's an update on rapid antigen test supply.
Yeah, that's right. So Mr Perrottet has promised that everyone who needs a rapid antigen test will get one, and he says that more of these tests are on the way, expected to arrive in New South Wales next week. Now, the New South Wales Health Deputy Secretary Susan Pearce has given us some detail about the plans about how these millions of tests expected to arrive late next week will be handed out. She was speaking specifically about how they'll be directed at first to vulnerable members of the community. Let's have a listen.
From our perspective, we have, as the Premier's noted, as a state, procured millions of RAT tests that will start arriving from the end of next week in particular in larger numbers. It is our intention to distribute those RAT tests to the PCR testing clinics to enable people to access them at that point. The other point to make, though, is that already we've been doing is distributing them to vulnerable groups of people, to homeless, to people in refugee areas, and to Aboriginal medical services as well.
Now, the other thing we've learned is that the increase in case numbers is having a significant impact on childcare centres as well. There's been more than 300 different childcare centres around New South Wales which have had to close in the face of these increasing case numbers. And the other thing that's changed is that the messaging about who should get a PCR test is really being pushed. We've seen around Sydney and in different parts of the state these illuminated traffic signs which have been popping up warning people not to line up for a PCR test unless it's absolutely necessary. On the Service New South Wales app, there's also been a push notification to those users of the app to say that you only need to line up to get a PCR test if you're feeling unwell with COVID symptoms, if you've been directed by New South Wales Health to get one of those PCR tests, or if you are a close household contact of a confirmed case. So again, the messaging is really an effort to put downwards pressure on the enormous demand on testing resources around the state. Kirsten.
Okay, Jamie McKinnell updating us from Sydney.